Hello, my name's Cathy Seed and I'm a nurse specialist in the Great North Children's Hospital.
Hi, my name is Lucy Craig and I'm a nurse specialist as well at the Great North Children's Hospital in Newcastle.
So the background for me is I was senior sister in children's outpatient department for over 10 years. During my time there, I saw the clinics grow and the demand and the high volume of patients coming into the department. We were up to 300 to 400 children a day coming into the department, and clearly some of these children were struggling. They were struggling, I could see visibly that they were struggling, so that was without any hidden disabilities. So I worked with my colleague, Lucy, and another colleague on how we could improve that journey coming through the department. We started very simple with a poster where families could take their child or young person off to a private area, a quiet area where they could be fed or medicines given, and that family wouldn't lose their place in the queue to see the doctor. After that, we developed areas where they could wait. So again, we could go, be it the playground, be it a quiet area of outpatients, and the nurse would know where that child was, would go and get them, and they would go through and see the consultant. After that, we felt we were growing and it was so well accepted by the families. The families felt we were recognising their child with the disability. So we started looking at a hospital passport that would then help families throughout the Great North Children's Hospital.
So we work really closely together, Cathy and I, as a small group with the Learning Disability Liaison nurses as well, who work within the hospital. And we work to develop a passport. The Great North Children's Hospital is a big hospital. We have 15 wards and departments across 2 different sites. Children's outpatients alone has 400 children accessing the department each day. And a huge number of our inpatients and outpatients do have a learning disability. They're under lots of different specialities and multiple appointments. So we really wanted to improve their experience of the hospital, we wanted to improve their journey. We just wanted to help these families and young people who were often struggling with these appointments. So after many meetings alongside the post, we developed this hospital learning disability passport. It's got all the contact numbers in the back to get in touch with the learning disability nurses, but it's a very personal document to your child and young person, parent held, patient held, whatever suits that family. And it's the aim of the passport was much to avoid repetition. So every time they saw a different doctor, a different health professional, or every time they come in, these families had to repeat what their child's diagnosis was, how they were fed, how they slept, how they accessed their hygiene needs, and this was hard for families. So the aim of this passport is the families bring this into hospital with them.
Yes, and certainly what we found in outpatients was as the child was queuing up, if they were holding their document, we could already help and improve their time. We weren't queue jumping these children, but we were acknowledging, and the nurses were, and nurses came back to me saying how much it helped them approach a family with a child with a disability, because sometimes they were struggling as well. So it was good for both patients and family.
It's a good flag as well, because not all disabilities are visible. So if the child or young person has a disability that's not visible to a health professional, if the families or the child had this passport in their hand, staff should be aware that this child might need reasonable adjustments with their appointment, with their admission. So we do hope that it has improved the patient experience.
So when they came in and needed a reasonable adjustment, or if this family were coming in and their child needed reasonable adjustment, I would work with, the team would work with the disability nurses on how we could make reasonable adjustments. So for example, a child coming in who can't cope with the noise and the volume and the crowds, there is a back entrance to children's outpatients. We would bring that child in that door, and the parent could go and book them in at the front desk while somebody else waited with the child. And we found then the child was far more ready for their appointment, the doctor could see the child, and it was so less stressful for the whole family. Another example was in the treatment room for bloods. If that child required bloods, often these children it's hard for any child having a blood test, but especially for these children that have already been through the department. So again, we could make adjustments in that we could maybe take them to a quieter area and make sure that they weren't waiting in the normal blood queue. And we found that worked really well.